Hello, dear medicos. We are again here with one of our topper. We are having the honor to have Dr. Vishwanath with us from Bhagalpur Medical College, DNB, rank 13. Such a nice achievement. The DAMS family congrats you for such a great achievement, beta. How
Thank,
you are feeling after getting such a nice rank?
thank you, sir. First of all, I would like to thank all the DAMS faculty member uh, for such an excellent teaching they have taught me. And it's
As a intern student, like you are our satellite student, he have joined our Bhagalpur Satellite Center and thereafter he joined our TND. So beta, आपने satellite classes भी करी हैं और आपने
yes,
live classes भी की हैं, तो how is your experience?
yes. I was a regular TND batch student in
Regular TND.
Bhagalpur uh, during my internship, and I have I'm recently doing my TND 4 in Gautam Nagar, Delhi.
Delhi. Okay. So how is the class notes? Like you make in class notes you made in the satellite in Bhagalpur and then followed by you attend the TND, test and discussion. So these class notes, what was the role of these class notes in your success?
Yes, during my internship, I have prepared all my class notes by subject wise, subject by subject during the VSET classes, and I have supplemented those notes by
TND, test and
TND
discussion.
test discussions and e-medicos videos and DAMS club informations.
So beta, जब when you attended this test and discussion in the satellite classes, तो आपको लगता है these class notes are sufficient? क्या इन
Yes,
class notes के अलावा भी कुछ पढ़ने की जरूरत पड़ी आपको?
DAMS notes are adequate, but if you have to excel your notes, then you have to supplement by the supplement the information shared by videos of e-medicos
It medicals.
and the DAMS club information, which is so beautiful, so nice, so elaborated.
So you have attended the class notes followed by your e-medicos videos and
Yes.
all the videos you are getting in the DAMS cloud.
Yes, my
You are
my main
supplementing.
priority was my notes, followed by the information shared by faculty members
On the exclusive club.
on different axes like e-medicos, DAMS club, unplug series,
So you are
etc.
using the technology and because of that all points you got this rank of rank 13 in DNB examination. Getting double digit rank is itself is a big achievement.
Yeah, it's very important to use all these apps because uh, now trends are changing because of the image-based questions are increasing.
Increasing,
You
yeah.
have to follow the visuals
Which
side by side, besides the adequate notes.
So as in like test and discussion, our faculties are showing you all the images with the help of all the MCQs they are discussing. So those images were sufficient for your All India DNB examination?
Yes, besides notes, all the apps like eMedicos that contains images in series.
So those
Subject
images were
wise.
sufficient for DNB or
Yes.
they asked something different?
No, almost same,
Almost
not
same.
exactly 100%, but they are 90% similar.
90% similar. So these images bases are many students are giving the excuse that there is a change in the pattern. And what
Yeah.
you feel with the help of e-medicos and exclusive club, you can fill up this change in the pattern?
Yeah, like 70% questions are asked from notes directly,
Okay.
and 10% questions are coordinated questions, integrated questions. You can say integrated question, which are you have to integrate the two different subjects in a one subject.
Rather than taking one subject, two or three subjects.
Two or three subjects, particularly in AIMS or and some questions of some NEET questions.
Okay. So how many MCQs, how you handle these class notes followed by MCQs? How many MCQs you used to do every day?
Actually, I didn't have many MCQ books. I only used to do CRS,
CRS books.
or
MCQs at the end of CRS.
I used to solve MCQs that are put by faculty on the DAMS club,
DAMS club.
which is almost 30 to 40. And I used to make MCQs from CRS 100
CRS.
to 120 by myself.
Very good. So 100, 100, 150 MCQs you're doing from CRS with the help of CRS, followed by few MCQs which are updated in the exclusive club. That
Yes.
was on recent trends and the new updates.
Yes,
Yeah.
like new drugs, new criterias.
So exclusive club played an important role on all these updates. How
For,
many?
for me, it's very important.
Very important for everybody. It's very important here. Even
Yeah.
for the faculties,
So,
it is very important. So now tell me how many times you revise all these class notes, beta?
exactly uh, Not sure, but 3 to 4 times.
Three to
More,
four times
three,
you
four.
have managed to revise all these class notes. Any specific trick or skill you want to share with the students
Yeah,
because you got
one
this rank
important trick
13?
is very important. Whenever you are going to study new subject, or means you are going to study new topic, you should make a gap for the previous subject you have studied before for the intermittent revision. Like
Okay.
if you are studying the pharmacology, you have to make a gap of 30 minutes or 1 hour for the microbiology that you have studied in
New
your
subject. Okay.
previous previous time, previous month or anytime.
How many hours you used to dedicate in one day? Everybody must be asking this question because everybody is seeing your rank of 13 in DNB
Actually, it's
mid-year
a
exam.
tricky question.
It's very tricky question.
Actually, because actually quality of ours
Art is
decides
more important.
more important than the the number of hours that you have studied.
Or overall, just you, if you focus in the last 1 year, how many hours you managed to give every day? Somewhere 6 to 8, 10 to 12. What is the duration you should study at least
On an
for getting
average, 10 to 12.
10 to 12 hours?
Yes.
Required. So what I'm getting from your words, ke DAMS, class notes, class notes, class notes, you add the points from exclusive club, you take the best advantage of e-medicos and all exclusive club, and this gave you this such a nice rank in All India.
Yeah,
What was your
yeah,
rank in NEET
exactly.
examination
Actually,
2018?
it was not so good. It was 12,600 something.
12,600. And you directly jump on the rank 13. It means everybody must want to know in the last 5 6 months how this test
Actually,
and
what
discussion model
happened to
helps
me?
you
Actually, what happened to me that my class notes was incomplete at the time of internship.
in internship. Okay.
Okay. And then I have tried my best to complete my notes. And recently, before 1 month, I have just completed my notes and I have revised all
Revise the
those
notes.
notes. And that's reflected my result.
Yeah, I'm getting your from your words. Okay, like in the internship, you have done a hard work when everybody is enjoying, and you have just made
Yeah.
those class notes, but those class notes were not complete,
Yeah.
and you have not revised those class notes.
Yes.
Now, with the help of test and discussion, you fill up the gaps and you revise again 2 3 times, and you get obviously this hard work of 1 year which you have done in internship that is only responsible for this rank 13. But somewhere you revise it again, it paid you. Yes.
Yes, sir.
Which subjects you want? Okay, which subjects are very crucial? If I ask you, okay, beta, choose any 4 subjects. Okay, these are very crucial for all India examination. Which subject you will choose?
Actually, these are subjects of second year. But it may vary from one student to other student because for me it may be PSM that
No,
is.
but what I'm asking you, okay, like in MCQ, like you appear for DNB, what you feel, okay, these subjects should be very strong.
Yeah, definitely subjects of second year
Second year,
and PSM.
PSM.
Because subjects of second year means pharmacology, pathology, and microbiology.
That is a base
That is it.
of medicine
That
search.
is base of medicine, or you can say it is a part of medicine, big part of medicine. That should be that must be strong.
So second year subjects you should focus more. With community medicine, definitely the more share is in the distribution is there in the all India examination.
Yes.
Then coming on your again strategies and all these things, how the MCQs of grand test, the quality of MCQs in the grand test help you in getting a good rank.
Yeah, like if I'm solving MCQ from any other guidebook, it will just give you one question, answer of one question. And if you solve the MCQs of CRS or TND questions, it will give the
Whole topic.
integrated answer that will help you to correlate other topics.
It will be integrated
And
approach.
importantly, if anyone is solving one question, it will help to cover almost one topic.
One
Almost.
topic. Yes. What we are doing in test and discussion, we are trying our best to compile the whole topic in form of one MCQ, and that is more required for this All India PG examinations. Any specific advice you want to share with your Bhagalpur Medical College students or your state students? Yes, this is a trick to
Yes,
get
sir.
this rank.
First of all, I would like to convey my message to my college colleagues or my college juniors of JLMCH Bhagalpur. First of all, if you have to do anything in your life, you have to dream of it.
Yeah.
Then you have to act on it. So first, dream of it, then act on it.
Excellent. So I feel everybody must be taking your words as motivation because you are just coming from All India rank of 12,000 to DNB rank 13. It means everything is possible. Nothing is impossible if we take efforts.
Yes, sir. Everything is possible uh, because I have never thought of this rank. Uh, I have studied well, but I didn't have.
But your hard efforts and your internship or last 4 5 months you have revised so many times. It means somewhere you were dedicated to get such a nice achievement and just hard work paid off. We congrats you again for such a nice achievement and we wish very best of luck for your future.
Thank
Thank
you,
you.
sir.
Thanks a lot.
And lastly, sir, last 1 minute,
Arey, you can take 5 minutes, dear. We are here happy to hear you.
so last 1 minute, I would like to convey a message to my juniors, and that everything is possible, nothing is impossible. If you are studying in peripheral college, I have,
Actually, I want to come on this point, but I deliberately didn't touch this segment. If you are coming from a peripheral college, Bhagalpur, it is a real motivation for everybody. If you are from AIMS, Delhi, or you are from Mumbai or Delhi colleges, take my words, students are fully aware. But I still know one of my batchmates in Mumbai, he was from Bhagalpur, and I know the students coming from the peripheral colleges, many struggles are there, many issues are there, and if you are getting ranked, take my word, it will be a big motivation for every peripheral college. Now you continue, you convey your message.
yes, sir. Uh, First of all, I would like to thank my juniors, particularly, especially Kailas Jha, who have helped me many times for many club informations or many more things. And I want to say my juniors or colleagues, they are so anxious to listen my words on Dams Club or
Everybody here, every
everybody,
student across the
every
country.
student. And everything is possible for everybody. Don't think you are studying in the peripheral colleges. You can do everything, but first of all, you have to dream of it. You have to work on it. You will definitely get what you want.
Thanks a lot. Thank you. And I wish you very best of luck. Thanks for such motivational words. Clear. Thank
Thank
you.
you, sir.